Feel the waves cut through me, hypnotized by the sounds of...
Dahil dyan ay nagbigay suporta ang World Health Organization at Department of Health sa panukalang Center for Disease Control na naganap sa Senate hearing noong May 6. Samantala sa pinakahuling report naman po ng Octa Research Group, maaaring bumaba na sa 1,900 average daily cases ang maitatala dito sa Metro Manila pagdating ng May 14. Yan po ay base sa naging pagbaba ng reproduction rate sa rehiyon at sa buong bansa. Pag-usapan po natin ang detalye niyan. Kasama po natin sina Octa Research, Dr. Butch Ong, UST Professor at UP Professor Ranjit Rai. Makakasama rin po natin ang molecular biologist, biology at theology professor sa Providence College in Rhode Island at research fellow din po ng University of Santo Tomas at Octa Research Group, Father Nicanor Austriaco. Magandang umaga po sa inyo.
Good morning.
Good morning.
Magandang umaga.
Good morning po. Sagutin nyo na, advise nyo na lang po ako, source, kung sino ang pwedeng sumagot at kung sino pong magkakaroon pa rin po ng additional answer dun sa question. Paka-advise lang po ako. Good news nga itong sinasabi po na pagbaba ng reproduction rate dito sa Metro Manila. Ano po, ito na po ba yung ideal na dapat nating i-maintain sa ngayon? Kung sino po ang pwedeng sumagot?
I can answer that, you said, no?
Yeah.
The reproduction number has gone down ever since we implemented ECQ early on, in the previous month. From a 1.9 our number, we are now down at 1.67, 1.69, and it has been steadily declining. However, when we went to MECQ, the decline was slower, of course, understandable because MECQ has lesser restrictions than an ECQ lockdown. So having said that, the hospital occupancy, especially the ICU, is still at almost critical level at around 69%. As we know, the critical level is set at 70%, 70. But all our hospital or isolation beds, ward beds are holding on below 70%. So our hospitals are easing up a bit. However, the ICU is still a little full. But ang nakikita kasi natin ngayon na yung ating daily new count is still very high at pre-surge level. When we started with the surge, it was around, I think, 4,000 new cases per day. Ngayon, lumalaro tayo around 7,000. So with that, the positivity rate is still at a high 15%. The ideal or the sabihin natin, the recommended positivity rate is only at 5%. So medyo malayo pa tayo with regards to the positivity rate. So there are a little, may mga mix tayo na interpretations din dito, although pababa ang ating R value, we still have our daily new count way above pa rin our pre-surge level. So we are hoping that by the end of this week or next week, sana maibaba na natin ang ating daily new count to a much more manageable level.
Opo. Source, kung kayo may additional po, advise nyo lang ako. Ito po bang projected 1,900 cases per day ninyo? Sir, ito po ba ay sa NCR lang at hindi pa kasama yung extended provinces natin sa NCR Plus? And may na-report din po yung Octa kasi na mukhang may mga provinces din po na may tumataas na kaso. Ito po ba? Paano po yung nationwide?
Si Dr. Butch. Dr. Butch?
Okay. All right. I can answer that. Outside Metro Manila, we do have some provinces which are areas of concern. We have Cagayan de Oro, Puerto Princesa, and Bacolod in Negros Occidental. So those are some areas where we are seeing a slight uptick in the number of cases. In the areas of Rizal naman, sa Calabarzon, Rizal, the ICU occupancy is still at 100%. So even dun sa NCR Plus bubble natin, meron pa rin tayong mga areas na medyo kailangan pa ng ng konting tulong pa, no? So outside again, no, outside NCR plus bubble, it's Cagayan de Oro in Misamis, no, Puerto Princesa in Palawan, and Bacolod in Negros Occidental.
Opo, speaking of NCR Plus naman po, na single out niyo po ba yung Laguna ngayon as not yet stable kumpara po sa iba pang nasa loob ng Greater Manila area? At kumusta po daw yung trend ng COVID cases ngayon sa Laguna?
For Calamba, for example, in Laguna, the ICU utilization or occupancy is still at 70%, no? Medyo mataas pa rin Calamba is improving a little bit, no? Kaya lang nasa mataas pa din ang kanyang hospital occupancy. So pagdating sa Rizal, no, sa NCR plus bubble natin, no, it includes Rizal, medyo mataas pa din, no? Hindi pa din nasa ideal level yung ICU occupancy nila.
Opo, pero tama po ba na yung masasabi natin na most improved naman sa NCR Plus itong Bulacan, sir?
That's correct, no? Sa Bulacan, nag-i-improve naman ng number of cases, no? May mga negative changes in cases tayo, and maybe I can browse through our May 8 Octa update, no? So may mga negative changes, meaning pababa, no? In Quezon City is minus 21%, Manila minus 26%, no? Makati minus 19%, Parañaque minus 32%. This is all in our Octa May 8 update, no? So gumaganda naman because of the ECQ and MECQ. It is going down, and it is going to have a sabihin na natin na positive outlook naman sana, no, kapag hindi ma-reverse, no. We'd like to remind everyone that the trends are still reversible, no. Hindi pa din ito when we say going down steadily, no, hindi siya definite na pababa na. At any point in time maaaring tumaas pa rin ito, but the indications in the NCR plus bubble are generally for the past few weeks are going down.
Opo, bigyandaan ko lang po yung tanong na ating kasamahan sa media, pero unahin ko na po muna si Maricel Halili bago po si Cresley na katarong. Ang tanong po ni Maricel Halili ng TV5, given the decrease on number of COVID cases, is it okay to place NCR Plus under GCQ after May 14? And how far are we from becoming an India? Kung sino po ang maaaring sumagot.
So I'll start by saying Octa research is still generally speaking, the trend is downward. The trend is downward for the whole region and NCR plus. This is good for all of us. But as we have also noted, the average daily attack rate is still high for many cities in the NCR. In fact, only Navotas is below the critical level. So this is something that we need to look into. Second, the positivity rate is still high at 14%. Okay, and we're hoping that in the next few days it will further improve. A third thing that we need to also look into, as Dr. Butch has also mentioned, is the fact that ICU occupancy is still quite high. So yes, we are healing. Yes, we're trending in the right direction, but we're still not yet there. So if it was purely, and we can understand, no, if government will have discussions about extending the MECQ, really because we need some more time to heal. We also need some more time for government interventions, so such as contact tracing, and of course expansion of hospital capacity, apart from testing, no, okay, and improving our own strategy and systems, no, as far as COVID-19 is concerned. We understand that we will understand that if government extends. Right now, it's that the trends are good, but we're not yet where we're supposed to be as far as managing the crisis in our region is concerned. So this is where Octa is. A part of the group is saying, all of us want, lahat tayo gusto natin mag-GCQ na. Pero yun nga, may mga indicators pa apart from R na hindi pa ganun kaganap, no, ang indication na nag-heal tayo. So mataas pa po yung average daily attack rate, and yung positivity mataas pa rin po. So very slow yung changes dito, and ang tingin ng ibang members ng grupo namin, kailangan pa ng konting panahon. Although other members are saying, I think we've achieved some level of improvement, and the trend is downward. So government can also consider a GCQ. But yun nga, we're very cautious. We would like all of these indicators to be below, no, critical levels, including ICU occupancy, including the average daily attack rate, just to sustain, no, to be able to sustain all the downward trend that we have achieved at very great sacrifice to the region and to the country in general.
Opo. Father Nicanor Austraco, baka po may gusto kayong idagdag. Father Nicanor?
Thank you. I just wanted to add that, the MECQ that we are in right now is actually not the same MECQ we were in August. So if you look at the mobility numbers, we are actually much more comparable to a GCQ. So we understand, of course, that the government wishes to reopen in order to revive our economy and provide the necessary resources for those our kababayans who are hungry. But as my colleagues on Octa pointed out, we want to sustain the good trends that we have had so far.
Yes, opo. Yan din po yung tanong ni Creseline Catarong ng SMN9 News. Tanong naman po ni Red Mendoza ng Manila Times para daw po kay Professor Ranjit, if papayag po ang grupo sa GCQ, ano pong modification sa GCQ ang kailangan nating enforce? Sa tingin nyo rin po ba sapat yung ginagawa ng gobyerno para palakasin ang pagbabakuna sa priority groups?
Okay, so number one, we will support whatever government decides. Okay, what we're suggesting is caution. What we're suggesting is a calibrated, slow, no, exit strategy, no, so that we can sustain the trends. Now, whether it's a GCQ or an MECQ, the terms don't seem to be as accurate as we understood it last year. What we have now is a very, very flexible MECQ. To answer Red's question, context is important. We are trying to prevent the entry of these new and more contagious variants, no? Very specifically from India. We don't know what the situation is with the sequencing as far as the 5 individuals who tested positive coming from India. So we want to await that. That's one that's one area of caution that we want to focus on. Number two, government is trying its best, no, to roll out improvements in its COVID response, and many of these improvements will require infrastructure, the training of contact tracing workers, expansion of hospital facilities, and this will take time, no. This is why it might be prudent, no, to consider an extension at this point. Of course, what we feel is important is that the industries, while if we decide to extend for a week or two, the industries that are closed down now can slowly, in a calibrated fashion, be opened up. Red, medyo nasa GCQ na tayo halos eh. If you think about it, no, only certain industries are closed down to prevent transmission. But these industries, if they comply with minimum public health standards, if they have the engineering to prevent transmission within their business establishments, and if their employees are vaccinated, I think we can slowly open up. No? The key here is to have a gradual exit, or whatever the government calls it, no? A gradual exit from the quarantine, so as not to reverse the trend. The trend can easily reverse, especially now that we have B117 here. We have the South African variant also here. So, it's a very, complex decision to make. But we will support government if it extends the MECQ as suggested by some of our fellows, no? to between 1 or 2 weeks, or if it decides to go on GCQ, but with modifications, with more strict monitoring and enforcement of minimum public health standards, not just in public areas, but also in the private sector, in for example, restaurants and malls, and then we will support that.
Yes, sa sunod pong tanong ni Red Mendoza, source, kung sino pong pwedeng sumagot at kung meron po kayong pwede rin sabihin, advice nyo lang po ako, ina-expect po ba natin ang pagbaba pa lalo ng kaso sa mga hospital in the next few days, at ano po ang inyong assessment sa ating hospital bed capacity?
Father Nick could answer that. Father Nick? Yeah.
So, as my colleague Dr. Butch Ong has pointed out, hospital occupancy has been improving gradually over the last few weeks. And we expect, as the daily caseload, as the daily attack rate continues to drop, we will expect similarly, with about a 2 or 3 week delay, a drop in cases. Now, one of the challenges that the national government has faced has actually not been the number of beds, but the number of staffing, especially nurses, to staff those beds. So one of the additional reasons we can provide for a slow, gradual reopening is to allow the national government to increase and enhance the nursing staff and the healthcare worker staff that would allow all the beds that are available to be staffed adequately at a standard of care that provides what is needed for our kababayans. So it will gradually improve over the next few weeks as long as the R is sustained. And we expect, hopefully, that by June, most, if not all, of our hospitals will have dropped below the critical levels that some of them are at this time.
Thank you. Ayon po sa DO naman, kaya raw po nagkakaroon ng pagbaba sa bilang ng COVID-19 sa Metro Manila ay posibleng dahil sa bumababa rin daw po yung mga samples na tinetest ng mga laboratorio araw-araw. Ito po ay siyempre makaka-apekto sa mga data na inaaral ng inyong grupo. So ano po ang masasabi nyo dito? Kung sino po ang pwedeng sumagot, sirs?
We were forewarned by Yusek Vergere about this, and in fact that's why we're very cautious. All of us, lahat tayo gusto na mag-GCQ kaso nga lang we have to get the data, we have to get a good picture. That's why we're holding off on a definitive recommendation kasi pinag-aaral pa po namin yung datos. Pero generally speaking, week on week nasa downward trend po tayo. Now how far down, okay, we're going to ascertain that in the next few days. Pero ang importante po talaga, kung ano man maging desisyon ng government, dapat siya calibrated po siya. Dapat po isaalang-alang niya yung pag-roll out ng mga improvements doon sa COVID response at sa testing, sa contact tracing. Marami tayong hinire na bagong contact tracers, nasa training pa sila. Hindi pa lahat na ilalabas, naro-roll out lahat ng plano tungkol diyan, lalo sa app, Number 3 yung pag-expand ng hospital capacity natin. Ang importante rin tingnan natin yung attack rate po. Yun yung titingnan natin na kung bumababa. Nasa critical po ang maraming lugar sa NCR+. So, yun ang pinapanood namin, tinitingnan namin ng mabuti. At aware po kami na may hindi lahat nakakapag-submit, at nasabihan kami this morning po ni Yusek ng DOH, na itong sitwasyon. Ganun pa man, at tuloy-tuloy pa dapat, kung gusto natin sustain yung ating downward trend, malaki ang role ng ating mga kababayan. Dapat tuloy-tuloy pa rin yung ingat. Mas lalo pa tayo mag-ingat ngayon. Tuloy-tuloy yung pagsunod sa minimum public health standards, yung pagsuot ng face shield, face mask, yung layo-layo natin at paghugas ng kamay. Importante yun. Ngayon MECQ, dahil nga medyo maluwag yung MECQ natin, nakikita natin nagkukumpulan, yung mga kababayan natin nagpapabaya at nagkukumpiyansa, yung may mga ilan tayong mga kababayan na ganyan na ang pananaw. Dapat tanggalin natin sa pag-iisip natin yan. Nakita na natin yung nangyaring last surge, marami namatay. At totoong-totoo ang COVID po. So kailangan kung gusto natin mag-sustain at maka-exit dito sa MECQ at mabuksan ang ekonomiya para hindi lang tayo may buhay, may kabuhayan pa tayo, kailangan ho magtulong-tulungan po tayo. Dapat tuloy-tuloy pa rin ho yung pag-ingat natin. Hindi ho namin gusto yung nangyari sa Caloocan ho, no? Talagang nagpapabaya ho yung iba nating kababayan. Hindi ho talaga dapat at this time yun kasi hindi pa tayo nakaka-exit na mabuti dito sa surge na to. So yan, at of course ang panawagan namin tuloy-tuloy dapat ang pagbabakuna. Kung pwede na kayo magpabakuna, kasama kayo sa A1, A2 at A3 ay magpabakuna na po kayo sa lalong madaling panahon. So yung mga ganyang hakbang makakatulong ho tayo para ma-exit ho dito sa MACQ at magkaroon tayo ng laya as far as the economy is concerned. So yun ho yung panawagan namin sa Octa, dagdagan natin pag-iingat natin.
Opo. Para naman po kay Father Nicanor, kayo po ba daw ay pabor sa binagong quarantine guidelines sa mga incoming passengers mula po sa ibang bansa?
Yes, so I arrived last night in the Philippines and I just started my 10-day quarantine. And I am aware that, the quarantine levels were increased from 7 days to 10 days. And I will be here in the hotel in Makati for 10 days. But I am very supportive of this change in the quarantine because we have to protect ourselves from the Indian variant, the B1617. Because what we have noticed is that in the last year and a half, every time there's a new variant, we have a surge. And so we have to protect ourselves. And the best way to protect ourselves from these new variants is to have as tight a quarantine border as possible. And the data shows that a 10-day quarantine will decrease the risk to less than 1% of transmission. So even though I'm fully vaccinated, I have received the Moderna vaccine, I completely consent to the quarantine procedures because again, we have to protect our country, and we have to protect our country from the Indian variant that, as we can see now in the United Kingdom, is quite transmissible and would cause another surge if it entered the Philippines.
Okay. Tanong naman po ni Jason na rubriko ng SMNI News, kailan po mararamdaman yung pagbaba daw ng COVID-19 cases not because of the ECQ and MECQ implementation but because of the vaccine na itinurok sa ilang mga residente na po?
So I can answer that. For the data from Israel and from the United Kingdom now and from the United States basically show that we have to vaccinate at least 45 to 50% of a population to see the effect, which means that here in the NCR, we would have to vaccinate about 6 million people of our 12 million people here before we see a substantial effect on the number of cases. So hopefully if the government's vaccine strategy and vaccine campaign, we hopefully will begin to see this probably in the third or fourth quarter of this year.
Po. Sunod pong tanong niya, do you think dapat daw pong unahin yung pagbabakuna dito sa Metro Manila before yung other areas since Metro Manila is the epicenter of the pandemic kung saan kalahati sa COVID-19 cases sa Pilipinas ay nandito daw po at 1/3 sa economic activity ng buong bansa ay nakatuon sa Kalakhang, Maynila?
So I too will answer that. So in fact, this week, Octa will release our modeling data that supports the claim that we should focus our vaccination strategy on the NCR in order to accelerate the healing that we have, as well as to decrease the total number of cases, the total cases in the country. So we hopefully will release that manuscript with the data later this week.
Opo. Mula pa rin po sa SMNI News Online, ayon daw po sa isang alkalde, dapat sa priority list ng government, sinunod na bakunahan ay ang mga economic frontliners o mga nagtatrabaho sa labas ng kanilang mga bahay after the healthcare workers. This if the government is really concerned with the economy without compromising the health of every Filipinos. What's your take on this?
See, I'll answer that. No, I think we are in total support of full vaccination of our adult population. No, kung meron lang talagang supply, talagang suportado namin talaga na mabakunahan pati yung mga economic frontliners natin. Pero right now po, dahil kung may problema tayo sa supply, kaya may priority listing. So sang-ayon kami sa priority listing po ng DOH na by risk category, no? So una yung healthcare workers natin, una yung mga matatanda natin sa lipunan na may mga at saka yung may comorbidities. Pero ganun pa man, yun nga, pinag-uusapan na ng Octa, January pa lang pinag-uusapan na ng Octa na baka meron tayong pwedeng i-tweak sa strategy natin aside from yung priority listing, no, magkaroon tayo ng regional approach dahil ho yung concentration po ng kaso dito nga ho sa NCR Plus, sa mga lugar ng Bulacan rin, Rizal. Okay, and so we were thinking baka this might be a way to slow down the epidemic in the country and then quicken yung pagbukas ng ating ekonomiya. And so yun ang suggestion ng Octa since January kami unang nagsalita tungkol dito na yung regional approach. Yung nga lang, naglalabas kami ng mga modelo. So may modelong ilalabas po si Professor David, may modelong ilalabas po yung grupo ni Professor Austriaco. Ang sumatotol ito, lahat pa rin ho ay babakunahan ho. Yung nga lang, mauuna ang NCR. Lahat ng healthcare workers dapat mabakunahan bago ma-implement itong model namin. So may assumptions po siya. At pangatlo ho, tuloy-tuloy pa rin ang pagbabakuna ng buong bansa. Yung nga lang, ang herd ipa-prioritize muna doon sa mga lugar na napakarami ho ng kaso. And hopefully, marinig rin ng ating mga government officials itong plano na to and makapag-recalibrate tayo. Lahat pa rin ho babakunahan. Yung buong bansa pa rin ho babakunahan pa rin. Pero yung nga lang, uunahin muna dito sa mga lugar gaya ng NCR Plus na napakarami ng kaso ho. At ang NCR ho, napakalaki ng impact sa ekonomiya. Kung bukas to, malaki ang impact nito sa buhay at kabuhayan ho. So, yun nga, we have limited vaccines. Let's see how we can strategically reallocate them to have the maximum effect as far as jump-starting our economy is concerned, apart from protecting our citizens po. So yun ay suggestion, dadaan pa ho to sa IATF. So ang dami pa hong dadaanan nito. Ito ay proposal lang ng Octa po.
For Father Austriaco, kumusta na po daw yung dinidevelop yung oral vaccine panlaban sa COVID-19?
So thank you for that question po. We are still working on that on the vaccine, and so I had to return to the Philippines because of the surge. But my students are completing the research that we have in the U.S. And as soon as our vaccine is producing the spike protein, we will. I am back here in the Philippines to begin the plans to start the testing at UST because we have to set up the laboratory at UST. We have to get our supplies. We have to get our mice. So I'm here to begin planning for the next step.
Okay, kami po ay nagpapasalamat sa inyong grupo at sa inyong panahon dito sa public briefing. Dr. Butch Ong, Professor Ranjit Rai at Father Nicanor Austriaco mula po sa Octa Research Group. Maraming salamat po.
Salamat po.
Salamat.
Maraming salamat sa inyong patuloy na pagtangkilik sa ating tahanan at pagsubaybay sa mga kaganapan na nangyayari at sa ating tagumpay na natatamo dyan sa Indonesia. Hopefully, we will see you again in our next update. God bless.